Axillary artery origin, course and termination starts at the outer border of first rib as continuation of subclavian artery, runs through axilla and continues as brachial artery at the lower border of teres major muscle. Area of distribution supplies all walls of axilla pectoral region including mammary gland. Superior thoracic artery from first part of axillary artery supplies upper part of thoracic wall and the pectoral muscle. Now, thoracoacromial artery from second part of axillary artery pierces clavipectoral fascia and divides into deltoid, acromial and clavicular and pectoral branches. Supplies pectoral and deltoid muscles. Lateral thoracic artery from second part of axillary artery runs along inferior lateral border of pectoralis minor. Supplies the muscles of thoracic wall including the mammary gland. Anterior circumflex humeral artery from the third part of axillary artery runs on the anterior aspect supplies the muscles of thoracic wall including the mammary gland. Large posterior circumflex humeral artery supplies from the third part of joint and the muscle runs posterior circumflex humeral artery intertubercular part of axillary artery anastomosis along the surgical neck of humerus with axillary nerve. Supplies the neighboring shoulder joint and the muscles overlying it and the circumflex humeral artery from subscapular axillary artery lies along the surgical neck of humerus with axillary nerve. Posterior supplies wall of deltoid supplies muscles overlying it and the posterior wall of axilla teres major latissimus dorsi subscapularis of axillary artery anastomosis along the muscles of posterior wall of axilla supplies muscles of posterior wall of axilla teres major latissimus dorsi subscapularis takes part in anastomosis around scapula. Brachial artery starts at the lower border of teres major as continuation of axillary artery, runs on anterior aspect of arm and ends by dividing into radial and ulnar arteries at neck of radius in the cubital fossa. Supplies muscles of arm, humerus bone and skin of whole of arm. Takes part in anastomosis around elbow joint. Profunda brachii artery, largest branch of brachial artery, runs with radial nerve in the radial sulcus of humerus, reaching the lateral side of arm ends by dividing into anterior and posterior branches. Supplies muscles of back of arm and its branches anastomosis with branches of radial artery and ulnar artery on lateral epicondyle of humerus. Superior ulnar collateral branch of brachial artery accompanies ulnar nerve, supplies muscles of arm and elbow joint. Inferior ulnar collateral artery branch of brachial takes part in anastomosis around elbow joint from medial side. Muscular branches arise from brachial artery, supplies biceps and triceps brachii muscles. Nutrient artery branch of brachial and enters the nutrient foramen of humerus, supplies blood to red bone marrow. Inferior ulnar collateral branch of brachial takes part in anastomosis around elbow joint from medial side. Radial artery starts as a smaller branch of brachial artery, lies on the lateral side of forearm, then in the anatomical snub box to reach the palm, where it continues as deep palmar arch. Muscles of lateral side of forearm includes the overlaying skin, gives a branch for completion of superficial palmar arch. Digital branches to thumb and lateral side of index finger. Radial recurrent artery, branch of radial artery, supplies elbow joint, takes part in anastomosis around elbow joint. Muscular branches, branches of radial artery, muscle attached to radius, that is biceps brachii, pronator teres, pronator quadratus, flexor pollicis longus, flexor digitorum superficialis. Superficial palmar branch, branch of radial artery in lower part of forearm before radial artery winds posteriorly, crosses front of thinner muscles and joins the superficial branch of ulnar artery to complete superficial palmar arch. Dorsal carpal branch, branch of radial artery as it lies in the anatomical snuff box, supplies wrist joint. Principal artery, branch of radial artery in palm, runs along thumb, supplies muscles, tendons, skin and joints in relation to thumb. Radialis indicis artery, branch of radial artery in palm, run along radial side of index finger, supplies tendons, joints and skin of index finger. Ulnar artery originates as the larger terminal branch of brachial artery at neck of radius, courses first obliquely in upper one-third and then vertically in lower two-thirds of forearm, lies superficial to flexor retinaculum and ends by dividing into superficial and deep branches. Gives branches to take part in anastomosis around elbow joint. Branches supply muscles of front of forearm, back of forearm and nutrient arteries to forearm bones. Anterior and posterior ulnar recurrent arteries, branches of ulnar artery, curve upwards and reach elbow joint, takes part in anastomosis around elbow joint. Common interosseous branches, anterior interosseous artery and posterior interosseous artery. Anterior interosseous artery, branch of common interosseous artery, runs on interosseous membrane, supplies both the bones of forearm and muscles attached to these bones. And posterior interosseous artery, branch of common interosseous artery, reaches back of forearm, supplies muscles of back of forearm, also take part in anastomosis around elbow joint. Superficial branch, large terminal branch of ulnar artery, joins superficial palmar branch of radial artery to form superficial palmar arch. Give branches to tendon in the palm. Give digital branches along fingers, also supply joints and overlaying skin. Deep branch, smaller terminal branch of ulnar artery that joins with the terminal part of radial artery to form deep palmar arch, which lies deep to the long flexor tendons of the palm. It also proximal to the superficial palmar arch. Branches of deep palmar arch join the digital branches of superficial palmar arch, supplementing the blood supply to the digits or fingers.